This is Dr. Badger from Mannheim, PA, correct?
Yes, from Mannheim.
And Dr. Badger, tell us your occupation and what the floaters were doing to your occupation.
I'm a dentist and want a lot of precision in the work that I do, and the floaters were floating into my field of vision and causing me to debate whether or not it was time to retire from dentistry, but I still felt there was a lot of things in dentistry I wanted to do. I wanted to see more patients, but I really enjoy going on mission trips, and the floaters were interfering with me considering that as an option. So to come and have laser surgery done on my eyes has been phenomenal, absolutely phenomenal.
Okay.
You know, I now have a field of vision that I feel is equal to anything I've ever had before, and so I'm not even questioning continuing on in dentistry, and like I said, enjoying the mission trips that I go on.
And of course, when we examined you, we saw posterior vitreous detachments in each eye, and
Yes.
actually what I feel was a relatively small floater, but it was close to retina, so it looked large. But tell us what your ophthalmologists up in Pennsylvania had to say about this.
Well, you know, for them, they thought that in order to get the vision I needed to have a vitrectomy done on both eyes, and not wanting to have, you know, the 3 different needles put into my eyes, and the black and blue eye, and the time you do one eye and then you wait and then do the other eye. It just wasn't an option that I wanted to pursue. At that point, retirement was the main option until I went online. And by going online, I saw Dr. Geller and saw a little video of him taking care of floaters, and I thought, you know, could this be for real? You know, could it really be for real? And the worst I had to do is come down and at least investigate, and with the investigation I said, let's do it. And I'm extremely happy for the end result. That's, again, allows me to accomplish and do the things that I want to do.
Thank you very much. And your ophthalmologists up north, were they a little skeptical, or did they say go for it?
No, they did not say go for it. The vitrectomy is the answer. And so I have a video that I'm going to give one to my ophthalmologist and one to my optometrist, so that they both can see that I'm happy, I can see the things I want to see, and let them make their own judgment call. But I think it's a wrong thing not to give that as an option for the treatment of floaters. I have already encountered several of my friends who have floaters who would not have considered anything because it was going to be so involved. And now, with a little bit of discussion, I think some of them will reevaluate their decision.
Thank you, Dr. Badger. It was a pleasure having you as a patient, and I'm sure your DVD to your ophthalmologist will help somebody in the future.
I sincerely hope so. It's a treatment that needs to be done. Just needs to be done.
Thank you very much.
You're welcome.